even after the intervention is scaled back or withdrawn. Again, these are all examples of continuity of care and service access. And what's interesting is that they've been proven to be effective even after the intervention scaled back or withdrawn. In other words, they have long-lasting results in preventing homelessness. Let's take a look at some examples of collaboration and partnerships. In Maryland, the Mental Hygiene Administration funds transition planning services for incarcerated individuals with serious mental illnesses and co-occurring disorders who are homeless. They provide specific transition planning services for these people. In addition, in Maryland, seed money is provided to 23 jurisdictions that have developed interagency advisory boards and agreements specifying the services community agencies will provide to ensure successful reentry into the housing market. So here again, you have a case of a state funding all the partners and all the stakeholders that are involved with that play a role in homelessness or preventing homelessness. All these different types of agencies from across the spectrum all join together and identify specific services that they can provide to ensure successful reentry. Let's take a look at some best practices of accountability. New Hampshire. The state of New Hampshire banned discharges to shelters in one of their new hospital discharge planning policies. A hospital is not allowed to discharge a patient to a shelter. The only place the patient has to go is a shelter. They can't go. They can't be discharged. Massachusetts. The mainstream systems in Massachusetts typically evaluate contractors on performance measures, but here's the clincher. Some of the key performance measures would be where homelessness is a negative outcome and housing is a positive outcome. And the outcomes are tied to incentives and disincentives in each system. So, for example, if there's a privately owned correctional facility, how successful are they? The state of Massachusetts has benchmarks where homelessness and housing play either a negative or positive role in the level of incentives that these private contractors might get. Same thing, privately owned mental health institutions. Again, the state contracts are dependent on specific outcomes, on specific measurements. and homelessness versus housing, weigh heavily on the level of incentives these private contractors will receive. Here's another one. Philadelphia and Massachusetts. They're reducing shelter beds by providing incentives for providers to provide prevention services and support in housing. Listen to this. The shelter providers are penalized if a former client reappears in the shelter system. Again, homelessness versus housing carries a lot of weight in measuring the outcome of the success. To the extent that if a shelter provider has a former client that reappears in the shelter system, they're penalized. These are all examples of accountability that have been strategies of accountability that have been deployed very successfully. Now let's take a look at some of the best practices for youth in transition. The federally funded independent living program for youth transitioning from foster care allows up to 30% of funds to be used toward housing for the youth until they reach the age of 21. Again, because we've identified that the 18 to 24-year-olds outgrowing state systems contain significant risk factors for the system. So we're going to focus. The program, the independent living program, provides up to 30% of the total funds to go directly towards housing for these people. In Illinois, the Department of Youth and Families Youth Housing Assistance Program, same type of thing. They provide housing advocacy and cash assistance to the youth aging out of the foster care. The housing advocates throughout the state assist with locating affordable housing and accessing social services. And here's the interesting part. In Illinois, there are grants to cover startup costs, and partial housing subsidies are available. Again, because we know that the 18 to 24-year-old population that is aging out of the state system contain significant individual-based risks of leading towards homelessness. So when focusing on prevention, we develop these systems. We allow up to 30% of funds go toward housing for these youth. We provide grants to cover startup costs and even partial housing subsidies for these people. Again, these are some best practice examples of youth in transition. Now let's take a look at some best practice examples that have been applied to re-entry for ex-offenders. States and localities are collaborating with criminal justice re-entry initiatives to provide housing and post-release support services. They've blended funds to create and provide new housing for formerly incarcerated people. They've reallocated some of the criminal justice and corrections capital, some of the funding that these agencies receive. They've reallocated that to housing agencies. In addition, there have been provisions where the correction/parole funds have to be used to subsidize supportive housing for former inmates. In addition, there's interagencies, there's cross-agency, cross-training for improved discharge planning. Again, we're going to focus on the communities that possess, in this case, system-based risk factors, and we're going to nip the homelessness before it hits. We know that this community typically has significant risk factors as it relates to homelessness. We know which agencies might be able to play a key role in preventing it. We bring all those agencies to the table, and then we go and develop strategies to prevent these people from ever becoming homeless. And some of the strategies that were used were either blending funds from different agencies, reallocating funds from specific agencies to other agencies that can provide housing services to these people, or providing subsidies, putting provisions in contracts with correction and parole agencies where they have to provide subsidies for supportive housing, specifically for their inmates. And in addition, there's cross-training for improved discharge planning. It's geared towards specifically prevention of homelessness. Now let's take a look at some of the best practice examples for people just coming out of detox programs, but pre-recovery support. So the Massachusetts Bureau of Substance Abuse Services, they support 2 programs to prevent homelessness and relapse for individuals leaving detoxification without a recovery home bed or other housing in place. And both those programs provide services and transitional housing for an average of 30 days. Because again, they've identified what communities present the greatest risk of homelessness. And once they've identified which communities have that risk inherent, they provide service and transitional housing for an average of 30 days. All in an effort to prevent homelessness. The bottom line is that housing is critical. There was one quote that the greatest challenge is not in the discharge planning itself, where the discharge planning process would typically involve assessing individuals and linking them to services. The greatest challenge is in a different area. The greatest challenge is in the development of sufficient housing and services.